So there's 3 O's: ophthalmologists, optometrists, and opticians. Okay, and I'd like to define these a little bit. An optician is kind of like the equivalent of the pharmacist fills the prescription. An ophthalmologist is somebody who's an expert when it comes to surgery. Optometrists, like Dr. Kellerman, are excellent when treating eye diseases like glaucoma or diabetic retinopathy or conjunctivitis or allergy or dry eye, those types of things, or eyeglass issues. We write prescriptions for medication and eyewear. So here's the reason for this confusion. Because both of these types of doctors do eye examinations. We both prescribe eyeglasses and contact lenses, and we both treat disease. But the ophthalmologist is an expert when it comes to surgery. The optometrist is somebody who deals with vision. Okay? So if you have a problem with your teeth, where do you go? Okay. If somebody has a tooth abscess, if they need a jaw to be rebuilt, where do you go? An oral surgeon. Okay. If a child is ill, where would you go? But if a child needs surgery, does a pediatrician do surgery? You need to see a pediatric surgeon. Okay. If you have a problem with your heart, you might see a cardiologist. Okay. But if somebody needs bypass surgery, a cardiologist doesn't do that. There's a subspecialty area in that area called cardiothoracic surgery. If somebody gets a lot of headaches, where might you go? A neurologist. Okay. But if somebody has a brain tumor, okay, you probably need to see a neurosurgeon. So the idea here is that these doctors are expert when it comes to surgical issues, and these doctors deal with most of the problems most of the time. What a developmental optometrist does, because blurred vision is a learned skill, much as the ability to learn how to drive a car or play the piano or hit a baseball. These are eye doctors that specialize in the diagnosis and treatment of visual skills that are critical to reading and learning and solving life's visual problems.